is if both of you could rise and take the oath. I would ask that you, do you solemnly swear or affirm that the testimony you're about to give before the Senate Committee on Veterans Affairs will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you very much. Please be seated. Okay. Mr. Secretary and Dr. Petzel, the floor is yours.
Chairman Sanders, thank you very much for that more than generous introduction. To you and Ranking Member Burr and the members of this committee, thank you for this opportunity to discuss the state of VA healthcare. I've been taking oaths most of my life, Mr. Chairman, so whenever I appear before this committee, whether I'm sworn or not, you have my best answers based on what I know, as truthful a presentation as I can make. Deeply appreciate your support and unwavering support for our nation's veterans. That's been true for 5 years now that I've worked with members of this committee. Mr. Chairman, I would also like to recognize that in the room here are others with whom I've worked very closely for 5 years, developing good dialogue, good collaboration. They've been very helpful in shaping what we thought was a priority in the Department of Veterans Affairs, and it's been a good, strong relationship. And I thank them for their partnership, and I know some of them will be testifying before you today. In those cases where we haven't always seen eye to eye, we've always managed to find common ground on behalf of veterans, and I expect we'll do that again. We at VA are committed to consistently providing our veterans the high-quality care, timely benefits, and safe facilities necessary to improve their health and well-being. This commitment mandates a continuous effort to improve quality and safety. America's veterans deserve nothing less. Our quality and safety meet high standards, and veterans should feel safe in using VA health care. That said, in health care, Mr. Chairman, as you point out, there are always areas in need of improvement. Any allegation about patient care or employee misconduct are taken seriously. And based on the background you just described that I followed most of my life for 38 years in uniform, and I am now have this great privilege of being able to care for people I went to war with many years ago and people I have sent to war and people who raised me in the profession when I was a youngster. Any allegation, any adverse incident like this makes me mad as hell. I could use stronger language here, Mr. Chairman, but in deference to the committee, I won't. But at the same time, it also saddens me because I understand that out of those adverse events, a veteran and a veteran's family is dealing in the aftermath, and I always try to put myself in their shoes. In response to allegations about manipulation of appointment scheduling at Phoenix, I am committed to taking all actions necessary to identify exactly what the issues are, to fix them, and to strengthen veterans' trust in VA healthcare. First, the Office of the Inspector General, as many of you have pointed out, is now conducting a thorough and timely review. If any of these allegations are true with regard to scheduling at Phoenix and elsewhere where we've invited the IG to come and look at issues that surfaced. If any allegations are true, they're completely unacceptable to me, to veterans, and I will tell you the vast majority of dedicated VHA employees who come to work every day to do their best by those veterans. If any are substantiated by the Inspector General, we will act. And I take Senator Murray's encouragement here to do something different, and Senator, I will. It is important, however, to allow the Inspector General to complete his duty, which is to conduct an objective review and provide us the results. Second, I've directed VHA, as some of you have noted, to complete a nationwide access review of all other healthcare facilities to ensure full compliance with our scheduling policy. And as we've begun that, we've already received reports where compliance is under question, and we have asked the IG in a number of those cases to also take a look. Third, I've asked for and received the assistance from President Obama. The President has agreed to let his Deputy Chief of Staff for Policy, Rob Neighbors, assist us in our review of these allegations and in any other issues we may find during these reviews. We start with scheduling, but we'll go wherever the reviews take us. Rob is a fresh set of eyes. He's the son of a veteran, and he's a proven performer who brings broad and significant management experience to this task, and I welcome his assistance. I've known the Neighbors family for a long time. Rob's dad and I were served together for many years, and I know his mom and dad well, and I welcome the assistance of Rob Neighbors. Even as we take these proactive measures, it's important to remember that VHA conducted approximately 85 million outpatient clinic appointments last year. As a large integrated healthcare system, VHA operates, as has been noted, over 1,700 points of care, including 150 medical centers, 820 community-based outpatient clinics, 300 vet centers, 135 community living centers, 104 domiciliary rehabilitation treatment programs, and 70 mobile vet centers attempting to reach the most remote of our veterans. This is a demonstration of concern by this department, trying to make sure that every veteran, no matter where they live in this country, and even our overseas locations, have an equal opportunity to have access to quality health care. As Chairman has noted, VHA conducts approximately 236,000 appointments every day. Over 300,000 VHA employees provide exceptional care to the 6.5 million veterans and other beneficiaries annually. VA health care is comparable to that in the private sector, meeting or exceeding standards in many areas. We always endeavor to be fully transparent, fostering a culture that reports and evaluates errors in order to avoid repeating them. Every VA medical facility is accredited by the Joint Commission, the independent organization that ensures the quality of U.S. health care through comprehensive evaluations. In 2012, the Joint Commission recognized 19 VA hospitals as among its top performers, and last year that number increased to 32. Additionally, as the Chairman has pointed out, the most recent American Customer Satisfaction Index ranks VA customer satisfaction among the best in the nation, equal to or better than the ratings for private sector hospitals. An overwhelming 96% of veterans who use VA health care today indicated they would use us again the next time they needed inpatient care, 96%, and 95% for outpatient care. I want them to continue to have that level of trust. Veterans deserve to have full faith in their VA. VHA is committed to a process of full and open disclosures to veterans and their families whenever any adverse event occurs. We participate in multiple external independent reviews every year to ensure the safety and quality of health care. VA will continue to aggressively develop and sustain reliable systems and train employees to detect and prevent healthcare incidents before they happen. I have detailed some of our many significant healthcare accomplishments of VHA over the past 5 years in my written testimony. I appreciate the hard work and dedication of VA employees, our partners from the veteran service organizations, as I indicated in this room, community stakeholders, many of whom we deal with on a daily basis, and then our dedicated VA volunteers. I deeply respect the important role that Congress and the members of this committee play in serving our veterans, and I look forward to continuing our work with Congress to better serve them all. And again, Mr. Chairman, thank you for the opportunity to appear here today.
Thank you very much for your testimony, Mr. Secretary. I'm going to start off with a simple question, and I'm going to ask some harder questions. And you or Dr. Petzl can answer. Very simple question. The VA healthcare system is the largest integrated healthcare system in the United States of America. 6.5 million veterans access it every single day. Mr. Shinseki or Dr. Petzl, what are the strengths of the VA healthcare system? What are the problems in your judgment? Is it a good system?
Mr. Chairman, it's a good system, and it's comparable to any other healthcare system in the country. In some areas and some specific occasions, we exceed even those good systems. For 5 years now, we've focused on 3 major goals for VA, all of it focused on doing better by veterans, which is what the President asked me to do when I came here. The first was to increase access. I think we've been successful at this. We've enrolled 2 million more veterans into VA healthcare. I think there's a net here, somewhere around 1.4 million, 1.5 million who are net overall increases. But over 5 years, we've enrolled 2 million more veterans. The second focus was to go after this thing called the backlog. And we've had this discussion for a number of years now. But we didn't simply go after the backlog just to end what was then, 5 years ago, a set of claims. We also acknowledged that we hadn't done very well by veterans of previous conflicts. And so even as we committed to ending the backlog in 2015, we also went and tried to bring justice to those who had never had the opportunity to submit a claim. I called on the good people in the Veterans Benefits Administration to take this on, and they did. And I promised them we'd give them a new tool called the Veterans Benefits Management System. And in 3 years, we fielded this new automation tool that make them.
How did we used to do in 2008 benefits?
All paper.
All paper.
All paper. And if you wanted to go faster, Mr. Chairman, you had to hire more people. And we had done that over many years. I think we have, 11,000 people who process claims, which is...
What I want to do now, Mr. Secretary, is pick up on some of the points, I think legitimate points, made by Democrats and Republicans. And the major allegation, I think everybody here understands that when you treat 230,000 people a day, mistakes are going to be made. And that's true of any institution of that size. But here's the major criticism that I hear from Senator Burr, Senator Murray, Senator Begich, and others, that this is not new news, that this is not new news, that these concerns did not arise yesterday, they did not arise in Phoenix, but in fact, there have been reports by the Inspector General, by the General Accounting Office on numerous occasions about problems having to do with scheduling and with waiting lists. Could you address how it could happen that year after year,
Sure.
these reports were made and there has not been significant action?
Yeah. I think it's important here to look at the GAO and the IG reports and what they intend to do. And they come in and give us some sense of where we could be doing better. And we get in there and we address those issues and take corrective action and, in essence, close out the report. It doesn't mean that we have solved every issue. It does mean that we've taken care of addressing those issues, and then when they come back, there may be another set of issues to deal with. I do understand Senator Murray's suggestion that we ought to take a comprehensive look at this.
I think what you're hearing from a number of senators and from myself is that everybody knows problems will arise tomorrow. That's not the criticism. The criticism is that year after year reports have been made talking about these problems, and the problems continue to exist. Can you give us some assurance of what happens tomorrow? Where do we go from here so that we don't have this hearing next year or 2 years from now.
Sure. And I think that's what the audit that we've created is intended to do. So while the Inspector General is looking at Phoenix for evidence of employee misconduct and evidence that 40 veterans may have perished awaiting scheduling, the IG is going to get to the bottom of that. What we're attempting to do is to address the Senator's broader question, is to take a look at ourselves and not wait for the IG's outcomes. And already we've begun to see some evidence that people are coming forward and saying, hey, I think there's an issue here, which I encourage. I mean, that's what we're after here. And if there were performance issues in the past, if they're continuing today, we want to put a stop to it.
All right, my last question, I've gone over my time, and is, in your judgment, based on what you know, are people, quote unquote, cooking the books? Is that, in fact, a problem within the healthcare system?
I'm not aware, and other than a number of isolated cases where there is evidence of that. But the fact that there is evidence in a couple of cases behooves us to go and take a thorough look. And that's why we have structured this audit so that a set of clinicians are not going to inspect their own areas. We've offset them so that a VISN 1 will inspect a VISN 10, and we'll get a comprehensive, a good look. But
I apologize, but my time has long expired. Senator Burr.
Thank you, Mr. Chairman. Mr. Secretary, again, welcome. These questions are for you, and I'll try to go as quickly as I can for the time constraints. Mr. Secretary, were you aware that on October 25, 2013, the Office of Special Counsel requested that the VA conduct an investigation into the allegations of inappropriate scheduling at the Fort Collins Community Outpatient Clinic, and that since then the media has reported about Mr. Freeman's email of June 19, 2013 that explains how to game the system to avoid being on the bad boy list? Were you aware of those?
Senator, I became aware of that screenshot, I believe is what it was, screenshot of a employee who was suggesting there are ways to game. I put that employee on administrative leave.
When was that?
That was last Friday.
Okay, Mr. Secretary, it's my understanding that on June 21st, 2013, VA received a report from the Office of Medical Inspector regarding chronic understaffing issues at the Jackson VA Medical Center, and that report described multiple patient scheduling problems, including scheduling 2 patients for the same appointment slot and scheduling patients for a clinic that does not have any assigned providers, often referred to as ghost clinics, and that on September 17, 2013, the Office of Special Counsel submitted a letter to the President of the United States on which the VA was courtesy copied, describing the findings of that June 21st Office of Medical Inspector report on the Fort Jackson Medical Center, including the practice of double booking patients and the use of ghost clinics. Do you remember reading that report and receiving that copied letter to the President?
I can't say that I remember it today here.
Okay. There was a December 23rd, 2013 report by the Office of the Medical Inspector regarding the Cheyenne Medical Center and Fort Collins Clinic that found that several medical support assistants reported that, and I quote, medical centers' business office training included teaching them to make the desired date the actual appointment, and if the clinic needed to cancel appointments, they were instructed to change the desired date to within 14 days of the new appointment. Did you read that report?
That report has come to my attention here recently.
Okay. On February 25th, 2014, your Chief of Staff, Mr. Riojas, submitted a response to the Office of Special Counsel, which included the December 23rd, 2013 Office of the Medical Inspector report on Fort Collins. And in that letter, Mr. Riojas states, and I quote, however, as OMI, Office of Medical Investigation, was not provided any specific veterans cases affected by these practices, it cannot substantiate that the failure to properly train staff resulted in danger to public health or safety. Were you aware of what your Chief of Staff wrote?
I was.
Okay. Mr. Secretary, were you aware that the GAO report entitled VA Healthcare Reliability of Reported Outpatient Medical Appointment Wait Times and Scheduling Oversight Need Improvement, which was publicly released in January 2013, and then on December the 11th, 2012, to that same report, your former Chief of Staff, John Gingrich, sent a letter to the GAO which stated, and I quote, VA generally agrees with the GAO conclusions and concurs with GAO recommendations to the Department. Do you remember that letter, that report, and your Chief of Staff's response?
In general, I do remember that report.
Well, Mr. Secretary, you knew that there were specific issues relating to scheduling and wait times as early as June 21, 2013 at Jackson, December 23, 2013 at Fort Collins, as well as numerous IG reports related to excessive wait times in January 2012 in Temple, Texas, September 2012 in Spokane, Washington, October 2012 in Cleveland, Ohio, September 2013 in Columbia, South Carolina, and December 2012, a GAO report which questions the validity and the reliability of the reported wait time performance measures, which brings us to today and Phoenix. On May 1, you publicly stated that you had removed Ms. Hellman as the medical director, and you stated then that that was to ensure the integrity of the IG's current investigation. On May 5th, Dr. Petzl conducted a conference call with all VISN directors, all medical directors, and the Chief of Staff, so a rather large group, to discuss the ongoing face-to-face audits of all VA centers and large community-based outpatient clinics. I have been told by sources that were on that call that during that call, Dr. Petzl made the statement that the removal of Ms. Hellman was, I quote, political, and that she's done nothing wrong. If you're asking us to wait till the investigation's over, doesn't the same apply to people who work for you? And Mr. Secretary, from all I've described to you and the current investigation that's currently going on, why should this committee or any veteran in America believe that change is going to happen as a result of what we're going through?
I was not aware of the phone call you referred to, and I'll look into it. I would just tell you that my removal of the director, placing her on administrative leave, was at the request of the IG. He is the lead in this comprehensive review. I don't get out ahead of him. He requested it, and I put Director Hellman and two other individuals on administrative leave.
I thank you, Mr. Chairman.
Thank you, Senator Burr. Senator Murray.
Secretary Shinseki, as I said in my opening, the announcement that the President is sending one of his top advisors to assist in this nationwide review is good news. I'm confident Mr. Neighbors will help make sure that this review is comprehensive and accurate. It is critical that this review is effective because at a hearing of this committee that I called in November of 2011, I asked Dr. Mary Schoen, VA's Director of Mental Health Operations, whether facilities were gaming the system and not fully reporting wait times, and she told me she was unaware of any facilities doing that and that VHA was doing audits to make sure it wasn't happening. But there, as you know, have been an overwhelming number of allegations system-wide that wait times are being doctored, and the oversight organizations have reported on it for years. The Department so far has been unable to provide me even the most basic information on how this nationwide review is going to be conducted or what it will look like, and I hope that is about to change, and I want you to explain how this review is going to be conducted.
Let me call on Dr. Petzl to give you details.
Thank you, Mr. Secretary. Senator Murray, there are going to be several phases to what we do. This week we are auditing with the in-person teams and an anonymous survey the first tranche of facilities, all 151 medical centers and our largest clinics. Starting next week, we're going to work our way down to all of the other sites of care, gathering information, and I think the anonymous nature of the questionnaire is particularly important, information about whether or not people have felt forced to do things that were inappropriate and lacking trust and integrity in the scheduling system. The second part of this is an assessment, as a number of people have mentioned, as to whether or not we have our resources deployed appropriately, whether or not we have the appropriate amount of resources, and just as importantly, whether or not we're using those resources in the best way at each one of our sites. I think everybody needs to remember that we do 85 million outpatient visits every year. 95% of those visits are with established patients, and those are all accomplished within 14 days.
I appreciate that. I want the details of how this is going to occur so that we get good information.
So we're going to focus on the new patient and the scheduling system that we have for new patients and all the other access points besides our clinics and our medical centers that we've got available for new patients. So first is the review to see how the scheduling system is being done. Second,
the assessment.
The look at whether or not we have.
Well, I would like to get the details from that on you, and I don't want to use all my time, but it's important that we know how that's going to be used and we know that real change occurs. But I just have a minute and a half left, and I want to ask you, Secretary Shinseki, Deputy Undersecretary for Health Bill Schoenhard told me at a hearing in 2012 that gaming is so prevalent as soon as new directives are put out, they're torn apart to find out how to get around the requirements. Testimony from a VA mental health employee said the exact same thing. And at that same hearing, Linda Halliday from the IG's office told us, and I quote, "If we have seen scheduling practices that resulted in gaming the system to make performance metrics look better at the end of the day over the past 7 years, they need a culture change. To get that culture change, I think they really need to hold the facility directors accountable for how well the data is actually being captured." That was more than 2 years ago, and the standard practice at the VA seems to be to hide the truth in order to look good. That has got to change once and for all, and I want to know how you're going to get your medical directors and your network leaders to tell you, whether it's through this survey or in the future, when they have a problem, and will work with you to address it, rather than pursuing these secret lists and playing games with these wait times.
Well, Senator, if there's anything that gets me angrier than just hearing allegations is to hear you tell me that we have folks that can't be truthful because they think the system doesn't allow it.
Right.
You know, trust is an important aspect of everything we do here, and has been in my previous life as well. And in order to do that, we have to be transparent, and we have to hold people accountable. And what I will say to you is we're going to get into this, and it's important for me to assure veterans to regain their trust, whatever has been compromised here, that when they come to VA, they come to a good, safe, caring system, and that they'll be cared for. And for all the employees that are listening in today, I expect our employees to provide the highest quality care, safest care we can provide, given all the comments about how tough it is in the healthcare industry, and provide access to benefits as quickly as we can. That's our mission. We only have one mission. It's taking care of these veterans, and not these veterans. I'm one of them. 100,000 of our employees at VA are veterans. We have a vested interest here to get this right.
This is absolutely critical. This review will not work if those people who are telling you the information do not tell you the truth.
I agree.
Okay. Thank you, Senator Murray. Senator Isaacson.
Thank you, Mr. Chairman. For both of you gentlemen, do you know William Schoenhard?
I do.
Yes.
Do you know him, Dr. Spetzel?
I do.
On the 26th of April in 2010, he sent out a memo to all the visiting directors throughout the VA entitled Inappropriate Scheduling Practices. Paragraph 2 begins, "It has come to my attention that in order to improve scores on assorted access measures, certain facilities have adopted use of inappropriate scheduling practices, sometimes referred to as gaming strategies." Then paragraph 3, and I'm going to read the whole paragraph because this is the key to the question, and I think it's the key to the issue at the VA. "For your assistance," and there's an 8-page attachment to this. "For your assistance, attached is a listing of the inappropriate scheduling practices identified by a multi-VISN working group chartered by the System Redesign Office. Please be cautioned that since 2008, additional new or modified gaming strategies may have emerged, so do not consider this list a full description of all current possibilities or of inappropriate scheduling practices that need to be addressed. These practices will not be tolerated." Are you familiar with that memorandum?
I am not.
Dr. Petzl?
I am familiar with that memorandum, yes.
Well, if it's not going to be tolerated, and for over 4 years ago you had 8 pages of known practices for gaming the system, what action, if any, and I don't think any took place, did the VA do to respond to William Schoenfardt's memorandum to see to it the VISN and the hospital directors followed the orders?
We have worked very hard, Senator Isaacson, to root out these inappropriate uses of the scheduling system and these abuses. We have been working continuously to try and identify where those sites are and what we need to do to prevent that from happening. It's absolutely inexcusable. The scheduler's responsibility is to be sure that that program is administered with integrity.
What do you do when you uncover one? Surely you've uncovered one. What do you do to hold them accountable?
The individuals are, as you mentioned, held accountable. I can't give you an example specifically, but if someone were found to be manipulating inappropriately the scheduling system, they would be disciplined.
Would they lose their job?
I don't know whether that's the appropriate level of punishment or not.
Senator, we can probably give you a little better answer to this because you're focused on scheduling. What I can tell you is in 2012, we involuntarily removed 3,000 employees for either poor performance or misconduct. In 2013, another 3,000 employees were involuntarily removed, and among them there were some senior executives as well.
Are those removals a reassignment within the VA healthcare system?
Some may be reassignments, others were departures, some by retirement and others by in effect being let loose by VA, let go by VA.
Well, I've read this entire 8-page memorandum, and there is no gray area. It's not we think this is happening, it's we know this is happening, and there may be other ways of gaming the system. And it talks about it's done specifically for the purpose of improving scores on assorted access measures, which I guess means the way in which their performance is evaluated as an employee. Is that correct?
I'm going to take your direction here. I have
No,
not
no,
read
no,
the
I'm-
memo.
no,
So I would assume that that's the.
And I would assume if the System Redesign Office had a multi-VISN working group, do you know what the System Redesign Office is?
Dr. Petzl.
Yes.
What is that?
That's the group that's responsible for ensuring that we're designing the work within our clinics and operations in the most effective and efficient way. And they have been given, at that time, they were given responsibility for monitoring and keeping track of access.
Yeah, and it says that the listing of inappropriate scheduling practices was identified by the multi-VISN working group. So you had a group within the Veterans Administration that identified on the 26th of August, 2010, various and numerous practices where numbers were being manipulated for the purpose of better outcomes, I presume, in terms of how those people would be rated. It would seem to me like there should have been a systematic in-writing practice where the chain of command would see to it that was not tolerated, as the memo said, and there was accountability to be had, including the loss of a job.
Absolutely agree with you. And we did institute that appropriate level of accountability. I will find out. I don't know whether anybody was specifically disciplined around that issue, but this has been a very important thing to us for at least the last 4 years, Senator Isaacson, and we have tried to root out those places where the scheduling system was being used inappropriately. It's
For
intolerable.
I know my time's up, but let me just say two things. One is, for the sake of the integrity of the Veterans Administration, you need to find out if there's an accountability system to respond to this memorandum from the 26th of August and what it was. And secondly, I'd like to ask unanimous consent to submit this memorandum for the record.
Without objection.
Thank you both.
Thank you. Senator Blumenthal.
Thank you, Mr. Chairman. Again, thank you to you and the other veterans who are here and who are listening for their interest and involvement in this issue. Secretary Shinseki, can you tell me how quickly we'll have some preliminary results to both the review and the IG investigation?
The Inspector General has his own timetable, and I don't have insights into what that is. On our audit, we're taking care of most of the large facilities this week. There will be some follow-up next week. Perhaps in about 3 weeks we'll have been able to assemble all the data, do a good analysis, and then respond in detail the way that members
Can you
have
commit that within 3 weeks you will have a report for us?
I think we should be able to do that, but that's preliminary right now. I don't know what data is being assembled, and we're collating it every day, but we'll shoot for 3 weeks.
And I apologize for interrupting, but as you know, all of our time is limited.
Sure.
As part of your management responsibility, don't you believe, and I certainly believe, that there's a responsibility from the IG to complete this report as quickly as possible within a matter of days and weeks, not months?
I agree that it would be helpful for the IG to complete his report as quickly as possible.
And can you give the IG a deadline?
I am not able to do that. The IG is an independent reviewer here, and once I turn this over to him, I'm primarily supporting his needs here. So,
Well,
in terms of
let me raise sort of the elephant in the room. Isn't there evidence here of criminal wrongdoing, that is, falsifying records, false statements to the federal government? That's a crime under the...
it should be, yes.
And wouldn't it be appropriate to ask for assistance from the Federal Bureau of Investigation or some other similar agency, given that the IG's resources are so limited, that the task is so challenging, and the need for results is so powerful?
Again, I will work with the IG to make that available to him if that's his request.
Well, may I suggest respectfully, Mr. Secretary, that it's your responsibility to make that judgment about the IG's resources, and without rushing to judgment, without reaching any conclusions, to involve appropriate federal criminal investigative agencies if there is sufficient evidence of criminality. And in my judgment, there is more than sufficient reason to involve other investigative agencies here in light of the evidence, more than allegations, but evidence of potential false statements to the federal government, and the need for timeliness and promptness in results to restore trust and confidence. What I'm hearing from my colleagues is the background about the systematic failures here and the need for also greater transparency and accountability. So let me ask my next question.
Well, it's a discussion on resources that I have had repeatedly with the IG to make sure. But again, every discussion about do you have enough resources based on what is underway, each new discovery adds to that workload. And fair enough, I'll have that discussion with him again.
Let me ask, will you change your management team, given that the background here shows systematic failings over a period of apparently years, not just months?
Yeah. Senator, I don't want to get ahead of myself or ahead of the IG here. I want to see the results. I want to see the results of the audit. And if changes are required, I'll take those actions.
If this evidence that we've seen already is as probative and powerful as it seems to be, wouldn't changing your management team be appropriate?
Perhaps. I'm still waiting for the results of the audit.
Thank you very much, Mr. Chairman.
Thank you, Senator Blumenthal. Senator Heller.
Thank you, Mr. Chairman. Mr. Secretary, I pointed out in my opening statement about the IG investigation about the treatment of a blind female veteran and the way she was treated at the emergency room in the VA hospital in Las Vegas. Have you had an opportunity to see the results of that investigation?
Senator Heller, I have had an opportunity to review that investigation, yes.
What was the conclusion?
Without revealing details about the individual, it was that she did wait too long and that there were others that waited too long in the emergency room. It did not have, in the estimation of the inspector, an impact on the eventual course of her illness, but it was inappropriate that a service-connected blind veteran should have to wait that long in our emergency room.
Thank you for the answer. Mr. Secretary, do you agree?
I do agree. I don't think any veteran, whatever the condition, should have to wait that long in any of our facilities, whether it's an emergency room or a clinic.
Mr. Secretary, have you received complaints about patients' wait times, scheduling practices for any other facility in Nevada?
I'm not aware of another facility in Nevada. Dr. Petzl?
I'm not aware of it either. I don't know the results of our visits to either Reno or the Las Vegas hospital, but I have not heard anything.
Will all of Nevada's VA hospitals and clinics have face-to-face audits?
Yes, they will.
Will the VA conduct more thorough audits later with the IG?
If we find that there were instances where there might have been inappropriate criminal activity, we certainly will enjoin the IG to come. That's difficult to predict depending on what we find.
Senator, are you talking about a continuing series
Correct.
of audits? I think based on what we find, if there's a widespread systemic issue here, we'll set up a program of sustaining looks to make sure that we've rooted out the kind of behaviors that we're talking about, either alleged or in fact.
After conducting those investigations, will you make that available to myself and my staff?
Yes.
To any member of the Nevada delegation?
Yes.
Great. To go back, obviously with the issues, Mr. Secretary, with what's going on in Phoenix, the waiting room, the time waits that we're seeing across the country, and of course in my state of Nevada, and of course the disability claims backlogs that we're seeing 3 times longer in the state of Nevada than what it should be. Do you believe that you're ultimately responsible for all this?
I am. You and I had this discussion yesterday. I think I need to provide you data that would be a little more current than 3 times the national average on waits on backlog claims. Perhaps true at one time. I'm told that those numbers are down.
Today's numbers are 355 days.
That's on.
That's still 3 times longer than
Okay.
national average. Would you explain to me, after knowing all this information, why you should not resign?
Well, I tell you, Senator, that I came here to make things better for veterans. That was my appointment by the President. Every day I start out with the intent to, in fact, provide as much care and benefits for the people I went to war with and the people that I spent a good portion of my life doing. This is not a job. I'm here to accomplish a mission that I think they critically deserve and need. And I can tell you over the past 5 years, we've done a lot to make things better. We're not done yet. And I intend to continue this mission until I've satisfied either that goal or I'm told by the Commander-in-Chief that my time has been served.
Mr. Secretary, thank you for being here today. Thank you, Mr. Chairman.
Thank you, Senator Heller. Senator Hirono.
Thank you, Mr. Chairman. In his testimony, Acting IG Mr. Griffin states that the VA's core mission is to provide quality health care. Is providing quality health care still VA's core mission, or have the goals of the VA shifted over time as they have expanded into providing other benefits to vets as well? And of course, I note that Congress has tasked the VA to provide job training, housing assistance, education assistance, reduce homelessness. So can you share your thoughts about what is the core mission now? And with all these other tasks that you now have, programs that you now have, are there, are you able to focus on your core mission of providing quality health care to our vets?
Yeah. Providing quality, safe, accessible health care for our veterans who have earned them is a core mission. But in order to provide that kind of health care, they still have to access the system. And that means we have to do a good job at dealing with disability claims. If we're not able to process those claims, the opportunity to access health care is something less. For the current generation of Iraq and Afghanistan veterans, it is automatic that they have 5 years of health care from VA. So for that group, that generation of veterans, it's a little different than others. So disability claims becomes an issue here because that then renders the opportunity to take advantage of health care benefits. I would say homelessness is also part of our responsibility. 5 years ago, we talked about homelessness as though it were a thing out there. What we've learned in 5 years, because we focused on ending it, is that depression, major factors that lead to homelessness, depression, insomnia, pain, substance abuse, substance use disorders. And then
Mr. Secretary, I'm sorry to interrupt, but my time is rapidly expiring, and the point of my question is that all of these areas that we have asked you to address with regard to our veterans, education needs, homeless issues, all of that, whether that is making it much harder for you to meet your core mission, and that may be a rhetorical question, so let me just move on to another area. As we look at the potential need for making systemic changes to how VA operates, I again note IG's testimony today on page 8, where he says that there is no national process to establish what are deemed essential positions to the delivery of health care. There is no standard organizational chart for VA hospitals and clinics, so it is very hard to determine what clinics are doing better than others. Would you consider these two areas to be potential systemic changes that we should be looking at making to the VA operations?
I think that's good insight here, and we will take a look at that. Part of our challenge is the complexity of the VA healthcare system. We have a series of hospitals that go from the very largest and most sophisticated, comprehensive kind of healthcare, organ transplants, brain surgery. We call them 1As, and then there are 1Bs and 1Cs, and then level 2 and 3s. All of this distinguishing between the level of care that can be provided there. It is a complex system, but I think standardizing the definitions of key leaders within that kind of framework would be helpful and sensible.
This next question may be one for Dr. Pretzel to very briefly respond to. We have heard that the VA has used bonuses and compensation as staff incentives to help bring down the patient wait times. And my question is, are these individual bonuses? Are these clinic bonuses? Are these individual compensations that occur? And how do you hold the staff accountable to ensure that these incentives are earned in an appropriate manner? What do you have in place to make sure that the gaming of the system is not occurring?
What you're referring to, I think, Senator, is the performance awards that are given at the end of the year. And each senior executive has a performance contract that has many, many elements, one of which, a subset of which, may relate to access. It could be stated in a variety of different ways. Has access improved, and then a percentage of improvement. Very few of them would state the absolute. Most of them are statements of what has been the improvement. So it is a part of a much more comprehensive evaluation system for senior executives.
But if you don't have accountability system in place, I think it certainly encourages the kind of activities that we are scrutinizing today. Thank you, Mr. Chairman.
Thank you very much. Senator Johanns.
Thank you, Mr. Chairman. Thanks for holding this important hearing, and I hope it's the first of many, many hearings. You know, Mr. Secretary, as you know, I occupied a cabinet post for a part of my career. There are some cabinet posts, as you know, by nature, are kind of a lightning rod. If you're going to be the Attorney General or the Secretary of State, you're going to get fired at every day. It's just part of the job description. The VA, on the other hand, in my judgment, does not fit into that category. And the other thing about the VA is because of the ranking member and chair and those who preceded them, it's a pretty nonpartisan committee. We don't sit around and talk about Republican Democrat stuff. We sit around and talk about how do we improve the lives of veterans who have served our country. And I've always applauded that. I think that we need more of that in Washington, not less. The other thing I'd mention is that there's been tough budget cycles. We know that. And yet you yourself have come to this committee many times and said you are resourcing us appropriately and generously under the circumstances, and we thank you for that. We applaud you for that. So then I look at this stuff and I go, what the heck? Mr. Secretary, one of the submissions we got from the American Legion was a map. Have they shared that with you, or has that come to your attention?
I think I may have seen a copy of that last evening.
This map is entitled Epidemic of VA Mismanagement, and it goes down through Burlington, Vermont, Pittsburgh, Durham, North Carolina, Columbia, South Carolina, Augusta, Georgia, Atlanta, Georgia, Jackson, Chicago, St. Louis, Austin, San Antonio, Cheyenne, Fort Collins, Phoenix, just place after place after place where the American Legion has thrown up their hands and said, my goodness, what the heck is going on here? Do you dispute what they're saying in this map? Do you think they are saying something here that's not true?
I am not aware of the basis for that map, but I accept that there are places that are listed here where we have had adverse events. And I would also point out that I don't know if in all, but in a good number, maybe the majority of those events, they were self-identified, initiated from within the Veterans Administration, Veterans Health Administration, which then allows us to go and investigate, figure out what happened, get the root causes, and then be transparent, tell people what happened.
But here's where I'm getting with this. So many hearings I've come to where we've talked about the waiting lists and the disability claims, and it's kind of one thing after another. I just walk out of the hearing like I've been given an explanation, so I will quiet down and let you go back to work. And I don't see the change that is necessary. And what worries me about this, and what worries me about what we're dealing with here, is it's systemic, it's cultural. It's people have just adopted this mode of operation as the way of doing business. Do you share my concern? Do you fear that the VA culture such that every rule you put out, even after this, you say, okay, folks, from now on, we're going to do A, B, C, and D. That's an order. Comes from the very top, Secretary. Do you fear that people say, how do we game that? How do we get around that?
I'm sure someplace in a large organization, you're always going to have something like that. But this is part of the reason why I engage the veteran service organizations on a near monthly basis. If there are any straight shooters here, it'll be them in terms of being direct with this secretary. This is why I've spent a good bit of time traveling the country, going to our facilities and talking to them about what's important, and engaging veterans in those locations as well. The voices that are most important to me are the voices of the veterans I encounter out there. And I will say there's an occasional concern that's voiced to me, and I always bring it back and go to work on it. But I don't have, not received that systemic look that's being described. There is a distinction between a medical mistake and manipulation or cooking the books. In the case of a medical mistake, I want people to stand up and say, hey, something's wrong here. Something isn't working, or we made a mistake, or I made a mistake. To do that, you have to have the confidence and honesty on the part of the workforce. And in many of those examples cited on that map, that's what initiated our concern. Manipulation, we'll get to the bottom of.
Thank you, Mr. Chairman.
Thank you, Senator Jones. At this point, what I would like to do is bring up these. Okay, Senator Begich is here. Okay, Senator Begich, do you have some questions?
Thank you, Mr. Chairman. I just wanted to catch that first vote as we were getting ready. First, again, I want to thank you all very much for being here. Thank you for the work we have done in Alaska. But let me just say that some of the comments I want to follow up on that other members have had. But let me first start with one, and I'm struggling here. I'll be very frank with you, Mr. Secretary, and I've again, all the good work we've done in Alaska to really go after some of these issues. Even though we're a small state, we've been able to accomplish some things that I think have made an improvement in delivery of services for our veterans. And to remind folks, having 77,000 veterans is a huge amount in Alaska. But the bigger issue is I was listening to Senator Burr's note of the 4-year memo and regarding identification of the issues that talked about scheduling and other issues. We talked about trust a little bit earlier, that it's important that we have trust with delivery of services and that we trust the people who are delivering the service of the VA. But if you have, and I will tell you from my time as mayor, if you have people that have been identified to have manipulated records, I can tell you from the city side, we would fire them. Yeah. Because we've lost trust. If they're cheating, then they're not trustworthy. If you just transfer them to another part of the government, then they just perpetuate what they have done, and maybe in a different field. So my question is, and I know you talked about the 3,000 people you have moved, dismissed, retired, whatever, but I want to know specifically on this issue, have you ever fired anybody on this issue when you find out that they've manipulated the records? Because to me, it's the fundamental question, because if it's just shifted around, then we're not changing the system to improve it. Help me, and if you can't answer that now, I do want an answer, because this to me is a fundamental issue. I would, as a former mayor, we'd fire them. They'd be gone.
Yeah, I would have to give you an answer that looked at across those specific reasons that we released 3,000 people, Senator. Manipulation, the very specific. This is something for me more recent. And without getting ahead of decisions, I would say manipulation of data, of the truth, is serious with me.
Would you fire him?
I will do everything I can within.
That's not the question. I understand.
There is,
you got-
there is a process here, Senator. Let me not get out ahead of it, so that in the end, I have it reversed because of predetermination.
Okay, let me ask you this then.
Yeah.
In the last, since that last document was it Schoenparts, William Schoenparts? I can't remember the memo, but that report.
Right.
Clearly, that report identified some people who have been doing some manipulation. So the question is, from that report, let's not talk about the future for a second, let's talk about that report and identify, was anyone fired for that activity?
I do not know. I had not seen that memorandum, but I would say if there was any manipulation that identifies individuals, I would expect to have seen their names in that list of 3,000, and that's what I can't tell you today. I need to do some research.
Can you get for the record for that?
I will. Let me just ask Dr. Petzel if he has any better insight.
Okay.
I don't have any specific information, Senator Begich, but we can go back and try and resurrect whether or not that's occurred.
Because if we're going to try to rebuild the system, and again, I want to say that, you know, we saw this problem when I first came into Alaska. We had backlogs on claims. We had scheduling issues. We had a lot of things. But we went after it, right? We went after it jointly to figure out how to do this. We did MOUs with the Alaska Native Health Clinics. We went after it with CARE Closest to Home program, which I know is going to run out of money at the end of this fiscal year if we're not careful. There's a variety of things we went after to try to figure. So I know we can fix this problem, but we still have challenges. And I think the biggest challenge is if we don't hold people accountable for actions that they manipulated or they redrafted the records to make it look better, then we're never going to solve this problem. And sometimes you got to have some heads roll in order to get the system to shape up. Because sometimes if they know, well, I'm just going to get transferred or I'm on leave and I still get paid, what's the real penalty? I can just tell you again.
We're not in disagreement here,
Great.
Senator.
Okay. I just wanted to hear that clearly. And let me again say, Mr. Chairman, I know this is just one of many opportunities we'll have. I know you're waiting for the IG report. That will give us some more opportunity. I'm hopeful that IG report, when it comes out, that there will be immediate action based on the report, not a further study of the report. IG says, here's the problems, we need to get after it. Because if we don't get after it, the VAs in this country and in Alaska will be the ones who lose out at the end of the day. And I think you recognize that the veterans will be on the back end of this.
Thank you, Senator Begich. Senator Burr wanted 2 minutes. I'll take 2 minutes as well. Now, those will be the last questions, and then we'll hear from the service organization. Senator Burr.
Thank you, Mr. Chairman. Mr. Secretary, in your testimony, you said, and I quote, I invited an independent investigation by the VA Office of Inspector General to conduct a comprehensive, thorough, timely review. If any allegations are true, they're completely unacceptable to veterans, to me, and to our dedicated VHA employees. If they are substantiated by the OIG, responsible and timely action will be taken. How do you define responsible and timely action?
There is a process to be able to implement those findings, decision regarding those substantiated findings. I will tell you it will be aggressive and as swift as I can make it. But there is a process here that's not entirely under my control.
Mr. Secretary, I'm sure you're aware of the IG report regarding the mismanagement of inpatient mental health care at the Atlanta VA Medical Center that was released April 17th of last year because Senator Isaacson and Dr. Petzel went personally and addressed it. And I'm sure you're aware that the IG report regarding the unexpected patient deaths in a substance abuse residential rehabilitation treatment program in the Miami VA Healthcare Center, because that was released on March 27th, 2014. In the IG's testimony that he'll give later, it says that both Miami and Atlanta, as the reports indicate, standard steps to ensure veterans were kept safe while under VA control were not taken, and 2 veterans died. In each instance, VA managers did not ensure the hospital staff performed their jobs. One, I would assume that you find Miami and Atlanta as unacceptable, and if you will, tell me what we've done in a responsible and timely manner to remediate that problem.
Dr. Petzel.
In Atlanta, Senator Burr, there have been 7 disciplinary actions, including the retirement or removal of 3 senior officials.
And Miami?
And Miami is still in process. But we will do this as quickly as we are able to do.
Thank you, Mr. Chairman.
Thank you, Senator Burr. 2 questions in my brief time. Number one, you have heard serious problems about waiting times in various locations around the country. I think Dr. Petzel informed us that in the last few years we are seeing 2 million additional veterans coming into the system. Is that correct, Dr. Petzel?
2 million new patients have arrived since 2009, with a net increase of 1.4 million.
Okay. And I would suspect that some of those patients are coming in with some serious problems in terms of PTSD, TBI, and difficult issues, yes?
Yes, sir.
All right, so let me ask you a very simple question. To what degree does the VA not have the resources to address that increase in patients? Are a lot of patients coming into certain parts of this country, and are we seeing waiting lists because you simply don't have the resources? What's the answer?
Mr. Chairman, the ability to, as I've said earlier, the ability to provide appropriate access to these group of veterans depends on several things. One is the people. Do we have enough people? Two, are we using these people most effectively? And 3, are we using all the other things that are available to us, telehealth, the fee basis program, et cetera?
Those are the issues. What's the answer?
Yes, one of the things that we're going to do is we're going to look at those places that are having access difficulties as a result of this audit and make a determination as to whether or not we have adequate resources there. My feeling now, my thought now is that we do, but we need to look carefully at those places where we are having access issues to see if it's a resource problem.
All right, let me simply conclude, and we're going to get to the...
Mr. Chairman,
yes.
May I add, this is not a once and done, or whenever we have a crisis, we do. This is an ongoing set of looks at ourselves.
Okay.
Our patient load grows each year, the complexity of the issues as you described. So this is an ongoing assessment that we try to get in the budget process, so there's an orderly decision-making.
Okay, my time has expired. Let me thank both of you very much for being here, and I would like to call up our second panel.